So last time we were talking about why patients don't trust their doctors, and it was more or less like we were speaking in defense of doctors, right?
Yeah.
So this time
you can't.
we are going to defend the patients.
Yeah.
And defending the patient means that we are going to give legitimate reasons why people actually don't trust their doctors, or why you should be a bit critical.
Hey, of course, that's what this channel is about, being balanced in our approach. Yes. And not lopsided.
Not lopsided. Sometimes it looks like we are defending doctors.
No, not so. But there are many things they don't understand, really. So
if you feel I'm defending a doctor, write it there that you are defending doctors too much.
Yeah.
Okay, so this time we would start with examples to make it interesting. So a few days ago, maybe about 1 or 2 weeks ago, there was a story in the news about a Texas doctor. He's actually a rheumatologist. And he was diagnosing most of his patients with rheumatoid arthritis. As a matter of fact, his rates were as high as over 70% of his patients, he diagnosed them with rheumatoid arthritis. And what does that mean? It means that those patients were perpetually on some kinds of medications. And
can't you argue that because he's a rheumatologist, he was getting referrals of likely cases that would come down with that would actually be rheumatoid arthritis? Yes,
we could argue that, but it won't be correct, because when they looked, this is a product of trials and investigations.
Yep.
So when they looked at other rheumatologists, they found out is rheumatoid arthritis. Is that the only diagnosis in rheumatology? The other specialists were making that diagnosis about less than 15% of the time.
Okay, and his own was 70%.
70%. So wow. Even when someone else sends a patient to you on the suspicion of rheumatoid arthritis, as a rheumatologist, you will now say, no, this one just looks like it is not.
It's not. Yeah, makes sense.
Yeah. So, but he wanted those patients to be diagnosed with rheumatoid arthritis so that he would treat them and get more money. And it was obvious that the man was living a lavish lifestyle. He had a Maserati, he had a private jet, he had all those things. Everything was rosy.
Soft life.
Soft life. Meanwhile, those patients, some of them were apparently supposed to be elderly patients, but he was giving them those therapies.
Yeah.
And there's a chemotherapeutic agent that is used for rheumatoid arthritis.
Yeah, methotrexate.
Exactly, methotrexate. So he had to give some patients methotrexate.
Wow.
Can imagine. So you can imagine the gravity of the fraud that man was linked with. And he was jailed for 10 years. 10 years. If someone who is a patient hears this story, what do you expect them to think? Do you think?
Second guessing you.
So once you tell the patient that you have this diagnosis, that was how Dr. This said you had that diagnosis, and it turned out not to be. So that's a true reason why people can feel, I don't trust these doctors. So I'll give another example of this is common in our climb, where you have some doctors who would say you must have a cesarean section.
Yeah.
Even though there's no indication for it. You just come to the doctor and he says, madam, this baby, we have to do operation to bring out the baby. And you ask the doctor, what is the reason? I say, madam, if you don't want, you will just die. It's not supposed to be like that.
Yeah.
If there is an indication for the cesarean section, the doctor is going to explain it to you. If as you walk in, the doctor looks at this woman is so short, there are other things he will now do to confirm that you will probably not be able to deliver by yourself, right? Or maybe it's not advisable to deliver by yourself. So I think you should say a bit about this.
There are clear-cut indications for what we call absolute indications for cesarean section, and there are quite a number of them. But sometimes we call some things relative indication. They can't stand on their own, really. But you have to look for something else to add to it before you can say, okay, absolutely, this person should have a cesarean section. Let me give an example of an absolute indication of cesarean section. 2 previous cars. So someone has had cesarean section twice. There's no negotiating it. There has to be a cesarean section again. But for someone who has had cesarean section just once, it's not absolute that that person should have a cesarean section again. However, indications like short pregnancy interval, maybe there's a recurring factor of what led to the cesarean section before is recurring again. Maybe there's fetal distress, maternal short stature, things like that. You now add 2 things joined together to say this person needs a cesarean section. And of course, you have to communicate it.
Yeah.
Communication is very key. Understanding the reason. A patient should be able to say, this is the reason why this thing is being done.
Yeah. You must note that there are very few of those instances where somebody would say you should have a cesarean section when you don't need to have a cesarean section.
Yeah, it doesn't occur. Right. It doesn't occur commonly. Actually.
So we shouldn't go around thinking once a doctor says cesarean section, maybe it's because he just wants to make money.
Exactly, it's not like that.
It's not like that.
Especially if you go to a good hospital.
Yeah.
You meet a good doctor, they are not likely to do that.
Yeah.
They won't do that.
That's why we always talk about you finding
the right
place and a place you can trust. Now, just based on the story I talked about just a few minutes ago, there are patients being diagnosed with malignancies. There's a tendency to think that, oh, those doctors just want to say this patient has breast cancer so that they can give them chemotherapy and make lots of money.
Yeah.
No, it's not like that. You would only find a few bad eggs, a few people who have allowed greed to take hold of them.
And they are like that everywhere. Yeah. In every profession, you have such people. Yeah. You have in banks, bankers who collide with fraudsters to defraud their customers. Exactly. So it doesn't mean that all bankers
and you have
are fraud.
Many good bankers.
And you have many good bankers
very
too.
Supportive.
Yes.
So the last example I'm going to give is about a fake doctor. Some doctors are actually fake, clearly fake.
Yeah.
When I say fake, means that person is being called a doctor, but the person doesn't have a license to practice medicine. On one of our series, we are going to talk about how to spot a fake doctor, but we are not going into that now. There's this story. This happened in Nigeria.
I think we should start clarifying this thing. A fake medical doctor. There are many doctors now. It's true.
There are many
doctors. So medical doctor. We are talking about medical doctors, yes. Medical doctors. So let's clarify that.
Yes. So I think it was just last year. There was the story of a doctor that was working in the Federal Ministry of Health, and he did not have a license. What happened
in Nigeria or Liberia? There was
this one I'm saying was in Nigeria. What he did was he stole the certificates of his friend, of a good friend of his, and used it to apply.
Wow.
You know? So if a patient hears this, the patient has a tendency, once any doctor is saying something, they want to feel, is this one? I don't think I trust that doctor.
Yeah.
Now, how do you now put all this in perspective? It means that you shouldn't just say, I don't trust doctors. You should just be wary, such that when you see things that are strange,
vigilant.
Yes, you can say, no, I'm not sure this is right. I'm not sure this is right. There's also a similar story outside the country where there was a doctor that was practicing for 30 years. As a fake doctor. He didn't have a license. He was practicing for 30 years. There was a pharmacy beside him, and the pharmacist there noticed that this is a strange doctor, because he was giving strange prescriptions. a drug is supposed to be a suppository, and the doctor is saying, no, you can take it orally.
Oh my goodness.
So until they finally caught up with the guy.
I used to know a doctor that would see patients. And you know, sometimes all these things stem from the beliefs of patients too. You know, generally in our climb, people believe until you give injections, you are not better. So I know this doctor who used to practice. He would bring people into his office, whether they need parenteral injections or not, is going to administer to them. And sometimes he will even give them water for injection. And people will be hailing him as the once he gives me that thing like this. So sometimes it's the view or what the patients believe that make those doctors behave like this. One is a real doctor, but he used to do that.
This thing you mentioned is common in one particular part of the country. I don't want to mention the part of the country. You will see people coming into the hospital. They say they want to flush their system.
There's nothing like that.
They want to flush your system, so they will connect fluid. Then they will give you a drug to be passing plenty of urine, and then you say you are
because you are making plenty urine. My urine was yellow before, it's now white.
Now white.
You are flushing this. They're just playing on your ignorance. And sometimes when people want to cut corners, you now find some bad doctors play on, capitalize on that. If you want to cut corners too, you see, if you want to cut corners, then what the output you get or the outcome you get will also be a dubious or a bad doctor. Sometimes people see people who are straightforward as being too strict or as being not nice. All right.
Summary is as many as 40% of patients actually don't follow the instructions of their doctor.
40%, whooping 40%.
And the effect is that patient outcomes will be worse. Because when the doctor says do this, and you say, and you go back home and you listen to your grandma who says do this, don't mind those doctors. You just want to make money. Of course, the outcomes are going to be worse. But sometimes you seem to have legitimate reasons, like we mentioned now, for not obeying those instructions. What we should do is to be on the guard, find good doctors. Once you find a doctor that is looking a bit suspicious, you should ask questions. Don't sit down there and keep taking in everything the person is saying. So ask questions.
My final thoughts on that is that sometimes when you have something, arm yourself with information before you meet the doctor so that you can ask intelligent questions from knowledge perspective. And if you feel that what this person really is suspicious, you can seek for second, even third or fourth opinion.
All right. Bye for now.
Bye for now.